Hello, welcome to my channel. My name is Dr. Tina. Today I'm discussing with you what happened after the NCLEX. If you haven't watched the first episode, then I'll urge you to watch it. Today I will be discussing with you my journey after the nursing board exam, and also I will also use the opportunity to educate others on deciding on which path of nursing to take. So I graduated in 2011. I started nursing prerequisite in 2006 and graduated with my prerequisites in 2008. So 2008 I applied to nursing school, and then I graduated in 2011. So after the NCLEX, I took my board in 2011. So after the NCLEX, they will give you a temporary license that you can use it to look for a job before they complete your license. So after you receive this temporary or you receive your license, then you can job hunt. You can put your CV or resume on Indeed and other websites, ZipRecruiter, and all the hospital or healthcare websites, and then start to apply for jobs. So for me, I started with home health. So what I did was I was just doing some part-time with the home health. It was a short period, temporary. So I will pick hours and go to the patients' houses and see them and give them assessment, and then take care of them, like blood pressure and those kind of stuff. That's what I was doing as a home health. But I did that for a short period. And then I went into nursing home. I did that for a few months. I applied to this. I went directly and I went to apply to this nursing home close by. And as soon as I went there, they hired me. So I started nursing home. It wasn't a joke. Nursing home is a lot. You see a whole lot of patients, like 60 patients. I was a brand new nurse, but it was a great opportunity to see how all these fields play out. It was a good experience, I would say. So from there, I went. My friend called me and said, "Have you heard about dialysis?" That was the first time I heard about dialysis, and it was a unique experience. It's a specialty on its own. So I went there. That was Fort Worth. I went there and applied for it, and they called me for an interview, and I was hired. So I started in the dialysis. So dialysis deal with long hours. It takes about 14 hours. We go there early in the morning. That time I had a little baby with me, so I had to drop them off at a babysitter in the morning about 4, and then get on the way because we start early. Dialysis open early. So those that don't know about dialysis is a treatment that is given to patients that have lost their kidneys functioning. So one can end up with kidney disease if you have high blood pressure and also diabetes. So if you have all these, it have defects on your kidneys, and so a lot of people lose their kidney functioning. They end up on dialysis. So that is where I was. So I did that for some years, and what we do is we put patient on a machine where we have access for them Some have PEM cath, that is, some call it catheter, is directly to the heart. And some also, we do have access on the arm for them. And so we put them on the machine where the blood is pumped out and cleaned by the machine and then pump it back to the patients. It was a unique experience. So I did that for years, and then I got into the hospital. So I started in acute unit, and it was quite a unique place too, compared to the various places that I have been to. So mind you, there are diverse places that one can work as a nurse. You don't have to limit yourself to one particular thing. So today, I'm using this opportunity to educate others that nursing is not only about bedside. Nursing entails more. So many places one can work as a nurse once you graduate. And also we have diverse path as nursing is concerned. So first of all, if somebody wants to do nursing as a career, we have several forms of nursing one can do. We have CNAs, certified nurse assistant. So they go through about some few months of education where they learn how to assist nurses by cleaning, laying of beds, and little stuff like that. And so they have training for them, and that is CNA, certified nurse assistant. So if you are heading towards nursing program and you need a side chick or side job, you can just go and do this few weeks or few months of education as a nurse assistant, and then you can be doing that on the side whilst you are in school. We also have LVNs or LPN. So licensed vocational practice or nurses are those nurses that also go through 12 months or to 18 months or sometimes 24 months of education. These nurses are trained to also administer medication and also take care of patients. And usually they work in a nursing home, but they can be working in any other places. Now, there has been some restrictions where they cannot work in specific places, but when you go to the nursing homes, mostly they work over there. And that is another pathway of nursing that one can do. So, for instance, if you are of age, let's say you are a foreigner and you come in here and you are interested in nursing, but you don't want to go take long in education, you can go to these two schools, the CNA school or the LVN or LPN school, and that will give you education to start nursing. So you can work as LPN in a nursing home, and they pass medications, they see patients directly, and they communicate with doctors and nurse practitioners as well. So another nurse pathway you can select is registered nurse. So registered nurse also have two types. We have bachelor's and we have associate. So associate degree is 2 years of education where you are trained as a nurse, and then bachelor's of nursing is also 4-year college where you are trained as nurses. Now the difference between associate and bachelor's is that associate is 2 years program, but you do take some prerequisites before you apply to the nursing program itself. For bachelor's degree, you will also use 2 years. That is how they have made it, but some people take long, 2 years to do your prerequisites, because there are so many prerequisites that you need to cover, and after that you apply to a 4-year college. So we do have 4-year college, 4-year university, and also we have the 2 years college, the 2-year college. Yes. So the associate goes to the 2-year college, and the bachelor's, if you want to achieve bachelor degree, you go to the 4-year college. But the thing is that after you finish the associate degree, which is 2 years college, you have short amount of period that you can also obtain the bachelor's. So if you are somebody that you are dealing with time, you don't have to specifically go through the 4-year college. You can just do 2-year college, and then after that you can bridge. And there are so many schools even now online that offers the bridge. So I will end here. I don't want to go too much into detail, and I will continue with it and go into detail how to pursue your nursing after you have decided on which path of nursing you want to achieve. Thank you for tuning in, and I will urge you to hit the subscribe button and also share with others. It's education. Many people don't have that background. I didn't have this background. That is why I've taken this opportunity to educate others that are interested in nursing, to know into detail what nursing is all about, some of the opportunities that we have in nursing that you can also achieve. Thank you. You have a blessed day. I love you. Stay blessed.